Hello, my name is Steve Goldstone. I'm the President and Chief Executive Officer of Winhealth Partners. I want to thank you for taking time today to join us for what we hope you'll find is an informative session entitled Winhealth Partners HMO 101. We're very pleased that you've chosen to participate in Winhealth as one of our members. We believe that it's our responsibility to help you get the most from your health care benefits with Winhealth. As part of our program today, we'll cover a number of topics. These topics include what is an HMO or health maintenance organization, what makes an HMO different from an insurance company, how are the premium dollars that you pay or your employer pays on your behalf, how are they spent, what determines what your premium levels are, issues that are being faced not only by Winhealth today, but the insurance and healthcare industry in general. What are we doing at Winhealth to attempt to improve both the cost and effectiveness of the care that we provide to you and your dependents? How does medical management review and authorize work? And then finally, what can we all do to help control our costs and the cost of health care? Winhealth Partners is a health maintenance organization, or HMO. We are the only state-licensed, domiciled HMO in Wyoming. As an HMO, we're different from traditional insurance. We're a highly regulated business, a business that must comply with rules and regulations as passed by the legislature in Wyoming and is implemented by the insurance commissioner and the insurance department. The HMO legislation or statutes in the state define an HMO as any person, except a person offering a dental-only or vision-only plan, who undertakes to provide or arrange for the delivery of basic health care services to enrollees on a prepaid basis, except that it may charge co-pays or members can have other financial responsibilities. It also dictates that we either provide or arrange for services through physicians that can be employed or under contract to the HMO. And in addition, we have to provide other healthcare services. And I'll describe each of those a little bit more now. First of all, Winhealth is an entity. An HMO can be either for-profit or not-for-profit. Winhealth is a not-for-profit organization. It is believed that not-for-profit organizations can provide more value. Any surpluses that we might earn are used to enhance the benefits we provide our members or to support our membership through the provision of additional services and health education benefits and the like. We provide or arrange for comprehensive health services. What we're not going to talk about today specifically is the benefit plans that you participate in, but you'll note that we provide a wide range of services, both in-network as a Tier 1 benefit, but as well through extended or totally out-of-network benefit plans. We cover preventative services, wellness, immunizations, injections, well baby care. We believe that it is better for you to seek care early rather than wait until your illness or injury becomes more severe. We offer these benefits on a prepaid basis. Prepaid meaning that the substantial portion of our revenue is generated through premiums and that you as a member have limited additional responsibilities. To the extent you do have additional responsibilities, it's in the form of co-pays if you use in-network services, and to the extent you choose to use our Tier 2, which is our extended network, or Tier 3, which is out-of-network, you'll have deductibles and co-insurance as well. We want you to get your services within our network, and as such, our benefit plans in Tier 1 are more comprehensive, and you have less out-of-pocket expenses if you get your care within our Tier 1 network. Tier 1 consists of contracted providers. We have 158 physicians in Laramie County. We have additional providers that you may be able to access in northern Colorado. And then should you decide you want to get your care from other providers, you can access our multi-plan network availability by logging on to our website, winhealthpartners.org, and there's a link to the extended network. As I mentioned a moment ago, we emphasize prevention and wellness. And finally, our goal is to attempt to ensure the delivery of medically appropriate care by the right provider in the right setting. And that is critical to our mutual success. This slide, which was produced by an organization called America's Health Insurance Plans, or AHIP, depicts how, on average, a healthcare premium dollar is spent. What it suggests, the green area of the slide, which is the vast majority of it, represents about 87% or 87 cents of every dollar. And on average, the insurance industry spends about 87 cents of every dollar on healthcare benefits. The remaining 13 cents is divided between taxes, administration, member services, sales and marketing, and finally insurance company surpluses. You'll note that in this slide it's suggested that on average insurance companies earn about 3 cents on the dollar. In other words, 3% of your premium dollar covers profits. The insurance industry is a risk-bearing business. Some years we have good experience and there are surpluses. Some years we have bad experiences or adverse experience, and we may lose money. It's necessary for us to create reserves to be able to stabilize our operations and to ensure that your premiums are more level than they might otherwise be. Now, specifically at Winhealth, while the national average is 87 cents of every healthcare dollar spent on health services, for a period of time ending in 2009, Winhealth spent 97 cents of every premium dollar on health services. This is good in the short term for you as a member. However, in the long term, it's not sustainable for us. It doesn't allow us to provide the level of administrative, marketing, sales experiences, medical management, and quality oversight that we need to provide. So over time, we have to get our number more in line with the national average. And there are a couple of very basic ways we can do that. We can do it through increasing our premiums, or we can do it through a combination of activities, including making sure that we provide only medically appropriate or medically necessary health benefits. That's where you come in, and we'll talk more about how you can help us in a moment. Question is, how are premiums determined? And this slide is designed to be a very general example. But basically, we have advisors or actuaries that help us set premiums. We look at our utilization and our experience on a periodic basis and estimate what our costs are going to be going forward. We attempt to project what the expected number of units of services that we're going to provide or pay for are. Number of physician office visits, number of hospital days, hospital admissions, prescriptions, visits to the optometrist, the whole list of services. We also, in the middle column, attempt to project what it's going to cost us for each of those units of service. And those then equal our total expected costs per each line item. We add those up. We add our administrative and profit load, and we determine what we expect we will need on a per member per month basis in order to cover our costs of care. I wanted to include a specific example because I think it's illustrative of the challenges that we all face together. In a 12-month period that ended in approximately April of 2010, Winhealth had 951 members that used 1,351 emergency room visits. Now at that time we had about 9,700 members in Winhealth, so roughly 1 out of 10 members had an emergency room visit. Those 1,350 visits cost on average $1,350. In other words, Winhealth spent $1.8 million on emergency room benefits in this 12-month period. If you divide that number by the 9,700 members and divide that by 12, it costs everyone every member of Winhealth, every employee and every dependent, about $15.67 per month. If on average there are about 4 members per family contract, for any of you that have family coverage, about $61 per member per month or $62 per member per month goes to cover emergency room visits. Now, if you have an emergency, the emergency room is the best place to get care. But for much of what happens in the emergency room, it's inappropriate. People use the emergency room because they have a cold, because they have a headache, because they couldn't get a convenient appointment in their physician's office. That is very costly to the health plan. It adversely affects our experience and it affects your premium. To help us all understand how to better utilize the emergency room, Winhealth introduced a 24-hour-a-day, 7-day-a-week nurse response line. Today, the healthcare system or the healthcare industry faces a large number of significant issues. We have limited resources. When I started in this business back in the 70s, there was a debate as to whether healthcare was a privilege or a right. All of us in graduate school at the time said, of course, healthcare is a basic right. Well, with rights come responsibilities, and we as a society need to take more responsibility for our own healthcare and our own health and wellness, our own well-being, and to utilize healthcare services more appropriately. There are also a vast number of treatment options today which get varied results. Not all care is equal. And to that point, there are varied patterns of practices today based on preference, based on regions in the country, based on physicians' training, that may not be current with today's best practices or based on evidence-based care. We have a segmented delivery system. Physicians practice in their offices. You may see a primary care physician in one office. They may refer you to a specialist in a different office. You may be referred to a lab in yet a different location. At the moment, in general, we don't have a single quarterback or primary care physician that's responsible for being your support system to make sure that you get coordinated health care. There's overuse as well as underuse of services. I talked about the emergency room. We have many examples of patients not seeking care in a timely manner. We need to make sure that care, again, is provided at the right time by the right provider. Many of us engage in unhealthy behavior. I used to ride a motorcycle. Sometimes I rode the motorcycle without a helmet. That's not responsible. Yet, if something had happened to me while I was riding that motorcycle, all of you would have been helping me pay for the care that I required as a result of my behavior. As a society, we don't exercise enough. We probably eat too much. We don't take care of ourselves. We don't manage our stress. And as you'll see in a moment, waste, fraud, and abuse really adds up to and contributes significantly to the cost of our health care. And then finally, we're dealing today, as we speak, with health care reform. What does Winhealth do to help improve care, the quality of care, and reduce costs? We use and we emphasize evidence-based practices. There are a number of organizations or entities in the country that we use and can use to help us make sure that the decisions we make with respect to whether care is medically appropriate or not are not subjective. They're not decisions that we're making based on our best guess or the phases of the moon or the time of the day. We use a company called Milliman and their guidelines, which are based on science. They're evidence-based, they're peer-reviewed. In other words, they're reviewed by physicians that practice in the specialty for which the guidelines were developed to help guide our decisions. We ask our physicians to, when they seek pre-authorization, if they do seek pre-authorization on your behalf, to show us what led to their determination that a particular procedure or course of care was required and appropriate. We compare those to the guidelines. And if they meet the guidelines, we pre-authorize the care. If they don't meet the guidelines, we may ask for more substantiating evidence. Give us the benefit of the doubt. If your physician says that blankety blank insurance company is refusing to authorize care, give us the benefit of the doubt. If we made a mistake, we'll certainly review our decision and reconsider, the basis upon which we made our decision. However, in many instances, we believe that there's perhaps a more effective way of delivering health care, perhaps more economical, and we ask that our providers work with us to encourage that type of care. As an example, we have a low back program. Many of our patients, members in the past, have been referred from their primary care physician to the neurosurgeons with low back pain. That usually leads to significant amount of testing and possible surgery. There may be lower cost, more conservative treatment methodologies available to us. We also work with our providers in a collaborative way through the various medical committees that we've developed that will help ensure that what we're doing here at Winhealth is consistent with the highest quality of medical practice available. As I've said, we use Milliman guidelines. We also use Hayes reporting technologies. These are nationally based standards recognized by not only the insurance industry but the provider community as giving us a method to make sure that we are objective and consistent in the way we determine whether care is medically indicated. There are other national organizations, the Agency for Health Care Research and Quality, sometimes referred to as AROC, as well as National Pharmaceutical Services, which is our pharmacy benefit manager. If your physician believes that certain types of care are indicated, they will seek pre-authorization. When they do that, we will first determine whether or not the care is covered by your benefit plan. Then we will compare it to the guidelines to take a look as to whether the events leading up to the request for a pre-authorization meet guidelines, whether the diagnosis is consistent with the guidelines. And assuming it is, we will authorize care. And I would say that on average, about 95 out of 100 times, this process results initially in an approval. Perhaps in 5% of the time there's some question, and in a couple of percentages of that time will we end up reversing a decision because we either misinterpreted something in the physician records or that that we have found more information subsequent to the initial determination. And that means that in a rare number of instances, we feel and we will deny coverage. Now, I want to point out that we're not saying that you can't get the health care. We're saying that Winhealth won't pay for it. And there's a big difference. To my knowledge, Winhealth has never said you can't have health care and never will say you can't have health care. We will make a determination as to whether your benefit plan covers the health care and whether we think it's medically appropriate or not. In a perfect world, one of my favorite programs is House. However, I'd hate to be one of House's patients. Those patients are prodded, poked, drilled on, have surgeries performed, and the question is more better? Winhealth, as I mentioned before, has introduced a 24-hour, 7-day-a-week nurse response line. That's there to help you as a member decide what the best course of care or treatment is. If you think you're having an emergency, but you're not sure, we would urge you to call Winhealth. You can call our main switchboard number, 24 hours a day, 7 days a week. Listen for the prompt, and it will automatically refer you to the nurse response line. I think the prompt today is 2. However, that may change, so follow the instructions. You'll be connected with a nurse, and once you've explained the symptoms that you're experiencing, they'll help you decide whether you need to go to the emergency room, whether you can go to an urgent care center, or you can wait to see your doctor tomorrow. Of course, if you're really confused and you're having, or you really think you're having an emergency, go directly to the emergency room. If you're in a car accident, a motorcycle accident, don't bother to call the nurse hotline, the nurse response line. We also have member newsletters. We have an excellent client services department, which is here to help you, to work with you, to make sure that you get the most from your health care. One of the things that we're doing is we're developing disease pathways. We're going to begin to better understand which of our members have chronic conditions, whether it's diabetes, asthma, congestive heart failure, congestive obstructive pulmonary disease, and develop programs that will help you deal with your chronic conditions on a day-to-day basis. We're developing wellness programs, and as I mentioned a moment ago, we have introduced the back pain prevention program, which we consider a step therapy. We're asking that any of you that feel that you have a back problem to talk to your primary care physician and try our back program. We'll teach you how to lift, we'll teach you how to stretch, to bend, and to attempt to get relief from your back pain without necessarily having surgery. Today, as we speak and as we meet, we're dealing with the effect of health care reform. Many of you know that health care reform, sometimes referred to as Obamacare, was passed in March of 2010. President Obama signed it into law on March 23rd of 2010. And the initial wave of changes began to take effect in September. And for those of you who are part of Winhealth but whose contract hasn't renewed yet, as your contract renews beginning October 1st, 2010 or after, you'll see some changes in your benefit plans. We can no longer exclude conditions for children under 19, pre-existing conditions for children under the age of 19. We, as Winhealth, as well as the insurance industry in general, have strengthened our internal appeals process as well as our external review process. Emergency health care services do not require pre-authorization. Now, again, what may be considered an emergency at the time you seek care, after treatment may be determined not to be an emergency. But if it's a true emergency, you don't have to get pre-authorization. Go directly to the closest source of health care. We can't apply lifetime or annual limits on essential benefits, and there's a long list of essential benefits. Coverage for dependents are now available up to age 26. For any of you that have a dependent between age 19 and 26, you can now enroll that dependent in Winhealth within 45 days of your open enrollment period. You don't have to be financially responsible for that dependent. That dependent doesn't have to be a full-time student. Now, if the dependent happens to be married or have children, we'll cover the dependent, but not the spouse or child. There's no cost sharing for preventative services. And in the case of rescission, which means we cancel coverage, we can only do that in the case of fraud. Many of these, including that last point, are things that won't affect you because Winhealth has never done it. Okay? But these are new requirements in the health insurance and healthcare industry. We all are adversely affected by waste. When my staff showed me this slide, I couldn't believe it. What it says is that $1.2 trillion, not billion, not million, not hundreds of thousands, $1.2 trillion out of a total healthcare spending of approximately $2.2 trillion is wasteful. Now, this was done by PricewaterhouseCoopers Health Research Institute. It's a nationally recognized organization. It's a startling statistic. What it means is something over 50 cents of every premium dollar, over 50% of all money spent on healthcare could be avoided. They've gone on to define that and classify that into 3 buckets. First bucket is behavioral. It's lifestyle, okay? It's what we do with respect to how we take care of ourselves or don't take care of ourselves. We drink too much, we don't exercise enough, we don't wear seatbelts when we drive, we don't wear helmets when we ride a motorcycle, we don't eat properly, etc. Things that we could do that would change our health status, that would help us all not only lead a healthier lifestyle, but be more cost-effective utilizers of healthcare services. So that's number 1. Number 2 is clinical. We've all heard of physicians practicing defensive medicine. Physicians are concerned about being sued for malpractice. It's a legitimate concern. As a result, they order tests which may not be necessary, but are ordered to make sure that in the event they're sued, they can demonstrate that they have tested you as a member for every possible condition. Estimates vary, but they're usually in the billions of dollars a year for what that adds up to. And then third are operational kinds of issues. The amount of paperwork that's involved in the healthcare industry, the amount of redundancy, the number of times that you have to fill out forms, the number of times your providers, physicians have to fill out forms, the inefficiencies in our billing systems and our payment systems and the like. We at Winhealth can work on that directly. And over the next couple of years, you'll see many changes, both here at Winhealth and also regionally, in terms of how data is collected, the use of electronic forms as opposed to paper forms, etc., all of which are designed to cut down. The earlier slide, about 10% of the healthcare dollar is spent on administration and overhead. We should be able to cut that. We need to be able to cut that. But according to PricewaterhouseCoopers, 1.2 trillion out of $2.2 trillion can be considered wasteful. Staggering. Finally, this slide, which was prepared by the Institute of Health Improvement, IHI, really depicts in one slide what we're trying to do. We're trying to create value. We're trying to make sure that you get the best value for your healthcare premium dollar. The slide at the top, you'll see population health. Our goal is to improve the health of the members of Winhealth partners. But to do so, we need to balance both the experience of care that you receive as well as the cost of care for providing that experience. If we do so, we'll be able to provide the right care at the right time, at the right place, for the right price. And we'll all consider this to be a positive experience. In summary, how do we solve this problem? Well, first we have to move beyond blame. It's not the insurance industry that's causing the problem by itself. It's all of us. It's going to take a team effort. We're all going to have to roll up our sleeves, pitch in, and help solve the problem. We're going to have to recognize our personal responsibility in this and take responsibility for our personal actions as we work together. We need to be accountable to a healthier lifestyle. If health care is a right, then we have responsibilities. And the responsibilities, in my mind, include us living a healthier lifestyle and taking better care of ourselves. We have to ask our providers to accept accountability for how they use healthcare resources. We have to change the way providers are paid. Today we pay providers in the industry on a volume basis. The more office visits they see, the more hospital days are produced, the more prescriptions that are filled, the better off we are. That doesn't have anything to do with the outcome of care. It has nothing to do with the value of care. So we need to create incentives for both you as members, for the employer groups that you're a part of, for the providers that are participating in Winhealth as well as Winhealth, in order to give us all an incentive to solve this problem collectively and to our mutual benefit. What we're doing is embarking on educational programs such as HMO 101 and others. We're moving to become more transparent, to share information and data with you more readily in terms of how your healthcare dollars are being spent. We're working to provide our providers with report cards, how the care that they're providing you stacks up, how the outcome of that care is, what the results are, and how they compare to their colleagues in this community. And then to provide both providers and you as members outcomes-based data. Finally, simply, what can you do? You can become an informed consumer. You can understand alternatives to expensive care and ask your doctor about them. You can seek preventative care. You can join wellness programs, exercise programs, eat better, learn more about nutrition, and please don't assume that more is better. In exchange, Winhealth Partners will provide more transparency. We'll work to change payments based on outcomes rather than on volume. We're working to establish and encourage our providers to establish electronic health records, to increase the access that you and your dependents have to health care, to provide better education, and offer quality reporting. Finally, I want to thank you all very much for being part of Winhealth. Our goal is to make sure that you have a good experience, that we provide high quality, cost-effective care which you'll consider to be valuable and a value to you. We hope you trust us. We're working day in and day out to earn and keep your trust. We're dedicated to that effort. If you have any questions or concerns, write us or call us. You can call Winhealth at 307-773-1300. We have a dedicated staff. My extension is 236. Feel free to call me if I can be of any service to you. Thank you very much.